Thank you, everybody, for joining us today for our KPHA and Curus overview and how-to of your KMAP pharmacy pharmacist enrollment. My name is Amanda Applegate. I am the Director of Practice Development for the Kansas Pharmacists Association, and I am joined today by Curus, who has been an extensive and invaluable help in this process as we go through kind of the next phase in pharmacy and reimbursement and billing. I will take a few minutes here to go over a little bit of the background, and then I'm going to turn it over to Curus credentialing specialist Ashley McSwain, because they have been, again, the absolute driving force behind some of this. I want to start by talking a little bit about kind of why we're talking about this, the importance of what we're doing here. And it starts maybe a little bit longer ago than people realize, back in August of 2023. After the passage of our test to treat legislation and the implementation of those protocols, Kansas Medicaid actually went ahead and submitted a state plan amendment to CMS at the federal level, authorizing pharmacists to be providers in Kansas Medicaid, which is a really big deal. There are a lot of states that still do not have this at this point in time. And so the bulletin actually reads, Kansas Medicaid will recognize pharmacists as providers and will reimburse pharmacies and or medical groups on behalf of the services that are not directly related to dispensing medications, which is what I think many of you are working towards today. So this was, again, very big coup, and we're really happy about it. However, you'll notice that even within probably 2 weeks of that coming out, the bulletin was then updated, and there's still some questions lingering about it. So we won't go into those today, but this is, suffice to say, this is a good big step in the right direction, but we're not quite there yet too. So those of you that administered vaccinations during COVID are probably very familiar with some of the current non-dispensing billing opportunities, in that if you were dispensing any sort of vaccinations or administering any sort of vaccinations other than flu shots, so COVID, for example, those would go through the provider type, provider specialty 25255, durable medical equipment and vaccine administration, because for some reason, that's what they had us put all of that billing type under. So they didn't add us in as pharmacies, they added us in as DME providers, and then they made a subset of vaccine administration for that. So right now, under that provider type, provider specialty, which many of you probably have already, you're able to bill vaccinations, everything other than flu shots, because flu shots do bill to the pharmacy side at this point in time. And then also that vaccine administration fee goes through that as well too. The other side of that too is then that that bulletin that was published in August created a new provider type. So PTPS 32276, non-physician pharmacist. So again, the pharmacist as a provider. And under that provider type, they put these test to treat services, and what we're in terms of the statewide protocols, flu, strep, and uncomplicated UTIs, and does require those statewide protocols to be followed. And they also added this subsection 2 of other different types of point of care tests. So many pharmacies right now are in the point where they have this DME already, and are working towards this non-physician pharmacist. The urgency of this is increased to some degree. So even if you are not yet doing test to treat services, you're not quite sure when that is going to be, Medicaid has indicated that they would like to move all vaccinations, including flu shots, over to this new provider type, provider specialty of non-physician pharmacist. And so ahead probably of this upcoming flu season, all pharmacies in the state that want to administer immunizations to our Kansas Medicaid patients do need to make sure that we have this provider type, provider specialty 32276 in place, and you're ready to go with that. The good news is that, as we're including all of these non-dispensing related services under this, is they have indicated they will cover anything that is in the state scope. So other things that we are in the process of working with them to get set up are going to be intramuscular administration fees. So we know that was passed in, I think, 2019. And so that's been around for a while, but we haven't had that option to get paid for it yet. So we're asking them to set that up. And as well as we in our statewide protocol for emergency antagonist dispensing, it does have the requirement that we provide counseling that is then not reimbursed. So we've asked for that to be included as well too. So hopefully, like I said, this is a start. It is a step in the right direction. We're not quite there yet, but we think that these steps are important. So as we go along with this, please don't hesitate to, we're monitoring the chat, where please don't hesitate to drop any questions into the chat, or do unmute yourself and ask any questions. But if you can, drop those in the chat and I will interrupt and move forward. So with that, I will go ahead and hand it over to Shelley with Curis to introduce their provider credentialing guide, and Miss Ashley.
Thanks, Amanda. We just want to encourage everybody to go to our website and download the credentialing guide. I think Amanda's going to drop the link in the chat if you haven't done it already. Right now, it's technically still in draft form. There's, as we move through this, we're going to need to continue to make updates. The individual application will be updated in the near future as well. So anybody that downloads it, we will automatically push out updates to that guide to you as they take place. That way you have a current guide and are staying current, and you won't have to come back and do that again. All we ask for is your name and email on there, so we're not trying to capture a lot of information. The other thing we're working to build is kind of a checklist, so that when you go log in, you can say, okay, here's what I want to apply, how I want to apply, and you can know all the materials you need to have on hand and be ready to make it as efficient for you as it can be when you get logged in. Lastly, I just personally want to thank KPHA and especially Amanda. Amanda's been working on this literally for months and years, quite frankly. And Ashley in our office has put in a lot of hours walking through this, trying to document this so that we can start to help pharmacists. So thank both of you for everything that you've put into this. So Ashley, you can go ahead and start sharing.
Perfect. Hello, everyone, and welcome. So this slide right here is going to slightly identify where we are in this process. Most of you should have already been through the facility application if you are billing for medication. And so that was always the very first application that you have to get done. If for some reason you're a brand new pharmacy and you haven't done it yet, that will be where you start. What we're going to go into today, though, is that group application and getting that new provider type in place. And this is for billing for the provider services. And then later on down the road, we'll go into the individual, and then we can tie it back to the group. So I'm going to share my screen. Just a moment. Shelley, are you able to see that new enrollment right there?
Yep, good to go.
Perfect. Okay. So to jump right in here, this is the link that you'll click on just to get started. And if you've downloaded our guide or any other guide, it has it right at the top. To be able to get in there, it's the portal.kmap/state right here. And it's just starting a new enrollment application. They have some great tips up here. I welcome everybody to review and glance through them, but we're going to just jump right in and get started. You're going to want to go right over here to this enrollment pre-checklist. This is how you begin the application. Today, we're going to start it as a group. Provider type is going to be that non-physician. And then it's going to be 240 pharmacy. The next option here is either EIN or SSN. You're going to want to choose your employer identification number. And then if your pharmacy is Medicare enrolled or not, for today's purposes, we're going to put yes. And then how you want to select your programs. We're going to do both. That's fee-for-service or the managed care organizations. We're going to choose both. Once you've made it this far and you want to know, hey, what does this enrollment need? You can do a quick little check here. It opens up a checklist, goes through what you've already selected in the top, and then it identifies what is going to come in this enrollment and things that you'll need to have on hand and ready to go to be able to submit this application. All of these we do have in the guide. If for some reason you don't have an attestation or you don't have a W-9, we do have links ready to go in our quick links. Once you've completed these steps, go ahead and start the enrollment. You're going to want to enter in your email. So if you're a credentialer filling this out, or if you're a tech or anyone else, you want to put in your email right here, because this is where you're going to receive an application tracking number. Later on, I'm just going to identify it as an ATN, but this is how you can log in and out of your application very quickly. Say for some reason you're not able to complete it in the first go around, and you need to jump back in. It's wise to write down the number just to have it easily on hand. This is my valid email address as well. If you have any questions over the next coming weeks or anything else, please jot this down. You can reach out to me directly if you'd like. Now, provider reference. This is where you're going to want to put something that makes sense to you. Right now, we're filling out the group application, and you can put for what facility it is, or anything that is going to easily identify this application for you. Say you're a credentialer and you're working on 10, and you're like, oh shoot, which one is that one? This is where that fills it in. All right. You want to start with registering. Okay, so right here you see these numbers. That is that ATN that I was talking about. This is a very handy number to have on hand, just in case it times out and you have to log back in to complete your enrollment. So just make sure that you mark it down, but it does also go to that email. So say you have an emergency and you completely step away and you're like, oh my gosh, I didn't write it down. That's okay. It was sent to the email that you put on hand. Some things before I jump right into the enrollment, just notice that anything that has that blue asterisk is a required field that you have to fill in. This whole enrollment takes approximately about 1 hour to complete. And a fun fact about this enrollment application is that the system sometimes is very slow to respond. And so there are times where you might have to click submit a few times before it accepts it to move on. Enrollment type, you're going to want to start with group. Upon doing that, all of these tabs will populate. So this generates which type of application that you're working on. Then you're going to, again, like we mentioned before, click that it's a non-physician. This right here states that once you have selected non-physician and you save and continue, you will not be able to change that provider type throughout the whole application. The effective date will be today's date. And then just start entering in the information for what's the best point of contact. I'm going to make up a fake name here today just to get us started. Your legal tax or your legal name here is going to be what's listed on your W-9. Your tax name is also whatever is listed on your W-9. And then doing business as is if you have a DBA name, you want to toss that on there. Your MPI is going to be your MPI 2, which is your pharmacy MPI, is the business MPI. And I'm going to do something interesting here. Okay. Okay. Are you currently enrolled as a provider? In this group application, you're always going to put no because this is a brand new enrollment. And then were you previously enrolled as a provider, even if this is maybe your second group application for a different location or anything else, you still want to enter this as no to allow for the creation of that new provider ID number. So always no, always no. Are you Medicare enrolled? Again, this is just what's particular to your pharmacy. If you guys are enrolled or not, we marked yes. By marking yes in these steps, it will populate different sections later on in the application. Will you accept patients into those? We chose both fee-for-service and the MCOs. Here is where you want to select which ones you want to associate with. It is suggested and recommended to choose all three, whether you are associated with them currently or not, simply because if you want to choose to add them later on, you'll have to go through more than half the application again. So it's best just to select all, or it's suggested to select all to begin with. Is your pharmacy currently registered as an CAQH? This is going to be no, because we are working on a group application. Your CAQH is your Council for Affordable and Quality Healthcare. It's essentially an online provider portal with all the information for different insurances to tap into to help with the credentialing process. Since this is for a group rather than a person, an individual person is going to be no. Right here, you're going to want to put the best contact information. This is for revalidation purposes. So if there is one person that needs to get the information to be able to revalidate in 3 years, go ahead and put that information here. One thing you'll know is that it does pop up the address. You do have to have a valid address in there, and then you have to select it from whatever populates. There are some fields like this that don't automatically fill in that you do have to fill in. And if you miss them, it will reject before being able to save and continue. So just make sure that you have a very complete application. All right, and then whatever type of communication will be best. Again, this was for the revalidation purposes. Save and continue. Resolve these. So if you have something that rejects and you're like, well, I thought I entered everything in, but it for some reason doesn't save and continue, you want to scroll to the very top. You're going to get this red ribbon. So X out of it, scroll down and see if you've entered anything. I did this part intentionally because I wanted you to see what happens if you enter something in incorrectly and it rejects. So let's adjust this right now. Ta-da! All right, so moving on over here to the specialties. The first section right here, you want to make sure that it has auto-populated with the non-physician, the proper new provider type. You want to click Create New, mark it as primary, and then just enter in the information. The only thing that should populate right here is that 240 pharmacy, and then you want to select the broadest taxonomy value. Taxonomy codes are for billing of claims. So the one that we suggest that would be best to start with, like a group for pharmacy, would just be this overall just supplier's pharmacy, or even just clinic pharmacy, which is this next one right here, or a community pharmacy, I'm sorry. So you're going to want to select it. Your effective date is usually just going to be today's date, unless there's some reason that you need to backdate billing of some of your claims. And at that, you can backdate up to a year. You can actually also forward date up to a year. I don't recommend that I don't think that most of you will be doing any backdating of this, but if for any reason, that is what this field is for. Just mark it for today and then move on. So now you see that it has entered this field. If I went to go create another one and have that same pharmacy, it will reject it. You can only have one up in here as your main blanket. But if your pharmacy by chance is community retail or compounding or long-term care or specialty or any of those others, you want to add all those in here. And we really suggest looking up your MPI number. If you've downloaded our guide, we do have a hyperlink right there that can take you right to it. And then just add everything that might be associated with your pharmacy. Nope, sorry, that's pharmacist. That's for an individual. My apologies. Everything for group will be in the bottom section here, and it's going to start with supplier/pharmacy and then what type. So just add anything that would be associated with your pharmacy. I'll put a couple in here and then do a save and continue. So this section right here is the service location. This is also for revalidation purposes, which they do every 3 years. You're going to want to click Create New. And then you have to mark it to the very first thing that you put in here as a primary. So fill in the first one. Your location name, this is where they would prefer you to just start with what the DBA name is. Contact information will be whoever is the best to contact for the revalidation purposes again. Okay, make sure they're all populated. Go ahead and put in the best email address for the revalidation. Okay, so this next section right here is for phone number. This is also for revalidation, but everything else below it is going into the public provider directory. They do ask that you enter in your hours of operation for the directory so that any person that is searching the directory can know who and what hours you hold. I'm not going to do that for today's since they aren't required, but it is suggested and preferred if you do enter that out. These next fields right here, it's okay to enter no or yes. It does not make any differences. It's not good or bad. This is all just related to what gets published in the directory. So ADA compliant, this is, does your pharmacy have handrails? Do you have handicap parking spaces? Do you have things along those? Mark them yes or no, it does not matter. Is it accessible by public transportation? So if there is maybe a bus route that runs by or anything nearby, you can go ahead and put yes or no, it does not matter. The after hours arrangements, as you see here, it does have the asterisk, it is required. This is where you can enter anything that might be pertinent, whether you just have a voicemail in place, or maybe you have after hours pharmacist phone number, or a voicemail stating if there's an emergency, call 911. If there's none, mark none. But just know that you are definitely not required to put an after hours phone number in this spot. If you really want to, you can, but this is a broad public directory. I'm just going to mark it that we have a voicemail in place, and that will suffice. Go ahead and save. Yes, that was from Tuesdays. All right, so it pulled it up for you. Everything looks good. You want to save and continue and move on to that next section. All right, so we're on step 4 now. This is different types of addresses. If the address was the same of what you've already entered in, just go ahead and click it, and this helps save you from the redundancy of filling everything in. It doesn't populate everything, so sometimes like the email address or phone number, you have to put in again. I'm going to just mark it that it is the same and keep moving on. A phone number is the same, so that looks good. Mail to section right here. Oh, real quick, so that pay to section, this section is for your legal business name and address where payments get sent to. It is required. Your mail to section here, this can be the DBA name and anywhere that you want mail sent to. I'm going to mark it that it's the same, but if it is different for you, just go ahead and put those in place. And I'm going to keep that all the same. All right, so these 4 down here, the informational address, the remit to, doing business as, and medical records, these are all very optional. It doesn't change anything either way. It's not required. The informational address is where you're going to get bulk information about maybe like policy changes or anything else. If you want stacks and stacks of junk mail, go ahead and fill this in. Otherwise, you're welcome to skip it. The remit to is the same as the pay to address. It is very redundant. If you want to fill it in, that's fine, but it is the same as that pay to address. Doing business as, this is not necessary. If you feel you want to fill it in, great, but it's completely optional. The medical records request address right here, this is if your pharmacy has a specific address used for the medical records department. Say you have like ROIs or anything else, specific place to get that documentation, you're going to want to enter that here. But again, it is completely optional, and you don't have to enter it. If at any point in time this processes and spins, and for some reason you think it kicks back, but you're like, oh, my information was correct, just click that save and continue again. This happens actually quite a bit. It seems to glitch. So it's not you, it's the enrollment. Organizational details here, you're just going to want to put what is most appropriate for your pharmacy. So what type is your pharmacy? If you're a corporation, for profit, just know that the individual, this is particular to the individual within a group application. So it will never be this one when you're filling out your group application, but just select whichever one is most appropriate for yours. Tax classification is the same, whatever's most appropriate. If you have the publicly traded, this means does your pharmacy offer stocks? So just pick whatever is most appropriate for your pharmacy. Moving on down right here, this is also if it's applicable. So if you're registered with the Secretary of State, go ahead and mark it. For the business start date, this is like the date of formation in Kansas. If you don't know it exactly, try and put your best date on there. I'm not sure that it really makes a giant difference, but just try and put the best date for formation in Kansas. This one is a little bit tricky, the chain affiliated. We don't believe that any of our independent pharmacies will be selecting this option. This will be more associated with any corporate chains. They're going to want to select this option. So if it's applicable to you, mark it and move on. All right, so this section right here, number 6, is a little bit tricky. For today's purposes, we are going to just skip it completely. And what its purpose is that this is where you're able to tie in your pharmacist. So once you have completed your group application and it has been submitted and accepted, then you get a 14-digit unique KMAP ID number. And that is where your individual pharmacist, the next application that we'll go into, that's where they will enter in that number and be able to tie back into this section. All of your individual pharmacists, once you've been through the process once, you don't have to do it again. It's not you have to do it for every single location like this. But so if I was filling this out, maybe this group application is for my second pharmacy, and I already had my pharmacist application accepted, this is where I could add in my pharmacist right there. So today you want to skip it as is. This is your first group application. You definitely want to skip this section, but just know that this associations tab is where you can bring your pharmacy or your pharmacist back and tie them to your organization. Hope that made sense. It's a little bit of a tricky section right there. All right, made it to number 7 here. This is going to be your credentials. You're going to want to put in the pharmacy license information. You want to click create new here, add in your Kansas. For this question right here, I don't want anyone to panic. If your pharmacy isn't board certified, that's okay. If it is, you want to select that Kansas certified right here, Pharmacy, Kansas Board of Pharmacy. But if it isn't, they say just select other, that's perfectly fine. For the dates, just mark them when you became licensed. I'm going to just select something on in here and select something a little bit later over there. If you do happen to have more than one license, go ahead and enter another one in. Medicare participation. So this section only populated because at the very beginning, first step, we marked that yes, we are Medicare affiliated, that we do have that in place. So this is where you're going to want to click a create new and start entering the information. This checkbox right here, you probably already selected doing the facility application. So consider for the Medicare crossover claims. What does that mean? By checking this box, it will allow for your claims to bill Medicare and then Medicaid in somewhat of like a cascading effect. We do think that it'd be beneficial, but we have not gotten a clear answer on that from the group application side for billing of provider services. So just know from everything that we've learned, we do think that it is best to click this box, but if you have any reservations or questions, please reach out to KMAP directly. Select whichever type you have, and again, you can create as many line items as you have. If you have multiple Medicares or anything else, just go ahead and select them. Select the dates that are associated. And then move on down. Medicaid program. This is asking if you're enrolled in any other states. So maybe your pharmacy is borderline right there with Missouri. Maybe you've already gone through this process and you have that Missouri one, or maybe you have one in Iowa or Oklahoma or maybe Idaho, it doesn't matter. If you have any that you've already done this process with in a different state, go ahead and select yes, and then you'll have to enter in the states. But today we're just going to mark no. We've made it to step 8 here. This is for CLIA. This section is only applicable to groups who are very specialized and work within a laboratory. It's a very unique section. Most pharmacies will not have this information right here. If there's a chance that this might be applicable to your pharmacy, if you have a very specialized kind of pharmacy, then you're going to want to enter that information here, and then the attachments in step 11. But if your pharmacy has a CLIA waiver, which is probably more associated to everyone here, and it's okay if you don't, but if you happen to, just know that, again, that's where you're going to want to add that attachment into the attachment section. So for now, save and continue. All right, so we made it to step 9. This is just specifically for the public provider directory. If you would like your web page to be published and easily acceptable or accessible, sorry about that, then you're going to want to enter that information in here. What's particular about it is they really want this format in place in order for you to enter that information in here. For example, today I'm going to put ours. And as you notice here, we do have that proper formatting in place, followed by that valid address. You're going to want to click Save and Continue. So this section is probably one of the longer. So the section 10 here, disclosures, this one takes a little bit of time, and you're going to want to read very, very carefully through each one of these. Every single one needs to be addressed, and every single question has to be addressed. I definitely recommend reading through what they give you here for information, as well as this, all of their disclosure information, and let's just get started. Every question has to be answered, like I just mentioned. If it's not applicable, just click no. This automatically pulls in for you. Make sure that it is accurate. I'm going to breeze through it pretty quickly, but I do recommend you take the time and really read through it and see if any of these are applicable to the pharmacy for that specific location. Redundantly, you get to enter your information in here again. All right, and then down here, if they have any questions about your disclosures, anything that you put in line or anything else, you want to have this address and information and this address and information just as a way for and a means for them to get in contact with you. A lot of things do seem duplicate. Just go ahead and put them in there again, even if they're the same. And then click Save. What you'll see by doing that, this first one that we went through, it shows the status has changed to completed. That works for every single thing that you move through. For speed of this, I'm going to just click no on this, but again, make sure you go through each one very carefully. This is a very important section. All right, once done, do a save and continue. Moves us right over here to that attachment section that we talked about earlier. These will auto-populate, make sure that they've populated correctly. You want the provider type to be that non-physician, and you want that specialty to be for your pharmacy. Right here, it says additional information, and I don't want you to panic if you are one of those ones that was not board certified. It says that the certification is required, and then you need that board cert or proof of residency. It's okay to ignore this whole section. It's not applicable unless it is. So if you don't have the information, it's okay. And if you do, great. Skip right on over. They just want to make sure that everything that is required for attachments, that you get those put in. Please know that there's always a scroll bar over here. So if you've entered all the top things and you keep clicking submit and you're like, why isn't it working? Just know that there might be more documents down here that aren't populating or that you didn't see. This is also where it's not listed as your required attachment, but if you had a CLIA form, the CLIA waiver, this is where you're going to want to enter it. So to tackle these up here, you're going to want to do it through the attachment details. There are multiple different ways that you can transmission and get them up in there. Most of them I'm going to click by mail just for the speed of it. And then it's best to search for it. There are quite a few forms in here. So I would just search for it and be like, oh, okay, there it is. And then click save. Know that if you put anything in by mail, they will not start processing it until they have all of these forms in place. If you put it in by the submission of like drag and drop from your computer, if you do it straight here by email or file transfer, and they get them a lot quicker, once they have all documentation, that's when they're able to actually start your application. If you do not submit your stuff by mail or anything else in the time that they need it, then your application will expire. So just some little tidbits to keep in mind. I'm going to make one of them here, just that file transfer so you get to see it. It allows you to go straight to your computer and select something. I'm just tossing something on there, but as you can see, you're able to pull it directly and just get it done. Also, you'll notice here the ones that I have selected have shifted from from no to yes, showing, oh, I have addressed this, I've got it up in place, something is in line, and then you just want to make sure that they've all been marked to those yeses. Again, as I mentioned at the very beginning, if there's one of these that you're like, I don't know where to get that information, we do have all of these specialized forms listed as a quick link in the top of our guide. For the liability insurance, also know that this is a pharmacy liability insurance at a 3 mil and a 1 mil and a 3 mil, 1 mil occurrence, 3 mil aggregate for that pharmacy, which is what is pretty standard, but just so in case you guys know. All right. I think that might have everything that I needed right here. So as you can see, all my requirements are showing that I have met them. You're going to want to scroll on down, save and continue, and move on to that next section. All right, issue processing. What did I do wrong? I don't look like I did anything wrong. Okay, I'm going to X out of it and I'm going to resubmit. This is not uncommon. So if there's something that you're like, what the heck? Just do it again. Sometimes you have to do it 2 or 3 times. So let's just I'm gonna take this one out just to make sure. I'm really glad actually when it does this that you guys can see firsthand that, nope, I've entered my information, everything is correct. I've clicked submit. Why does it keep doing this? It's not you. Again, it is the enrollment. It is there. It glitches a lot. Let's hope we can carry on and move on to section 12 right now. Boom. As you see, it didn't really make any changes and it went right through. So again, if that happens 3 or 4 times, do not panic. It is not you, it is them. All right, so we made it to section 12 here. This is where you want to review everything that you've submitted. This is what shows that you've selected the Aetna, Sunflower, United. These are your MCOs. You want to look over what the terms are. Did I enter my information incorrectly? My legal name, my contact name. Review all of your stuff. Is your MPI incorrectly? And then you're going to want to click proceed. Here is the provider agreement. This is also listed up in our quick links. So if you want to download it or have it on hand without having to go back into your application, we do have that available for you. You're going to want to just really go through their details. This is everything related to this new group enrollment, things that you need to know, the different change of ownerships, everything else. So go through this, read it, be thorough, and then you're going to want to click I accept, and then click yes. Scrolling on down here, the next is your digital signature. You're going to want to accept, enter in your information. If you have particular comments that you want to put in here for KMAP staff while you're entering it, if there's anything at all that you just want them to know or understand or have a question on for them to reach out to you, enter that in here. And then you want to move on to this verification. This is that little step where they're going to send you a little code that you'll be entering in down here. So request it. If you guys don't mind waiting for just a few minutes, we're going to wait and receive that so that you can see what the final step is.
So this is a great time now as we're waiting for that to come in. Please don't hesitate, drop any questions that you have about this process into the chat, or go ahead and unmute and we can ask Ashley now.
All right, so I did get that code. Like you see here, it takes, maybe a minute or 2 for it to process and come through. It's great and quick. If you don't get it quickly, you might want to review why there might be an issue. All right. And then I'm going to click submit. Even though all my information in here is mostly just for testing, because I have all those fields marked as like they're coming by mail, they won't even process this until I actually submit those informations. So put your verification code in, click submit. Yes, I want to move forward. And it brings you to the completion last page once it processes. And right here, you have this lovely tracking number. This is where you can go back in and figure out what the status of your application is. As I showed you at the very, very, very beginning, the front page, there are different ways to know what the status, where it's at, if there's anything, any identification that needs to be fixed or anything else. But this is a great number here, so you can know where you're at for your application. I'm going to stop sharing and turn it on back over.
Perfect. Thank you. I know you guys have questions, so please don't hesitate, unmute, ask, drop those questions in the chat. I've got a couple, but I'll do just kind of a quick reminder of that. This is the group application that we went through today. And unless for some reason your pharmacy is brand new, that's where you're starting for this process. So we encourage you to go ahead and start that process today. You have the how-to guide, and Miss Ashley just walked you through everything, so you should be good to go to get all of your information in and submitted here in the maybe the next hour. Take the rest of the afternoon and take care of this. Your next step is going to be your individual within a group, and we'll probably have a webinar for that in the next 4 to 6 weeks, so we can walk you through that process as well once more people have that individual within a group section ready to go. So again, I say start this process now, because this can take a very long time to get from starting that enrollment process to ready to bill. So especially as we're looking, down the pike at our next flu season coming up, if we're moving all immunizations to that, you want to make sure that you're able to serve that Medicaid patient population as soon as that flu season starts. So do start that now. Again, enroll in that group pharmacy first, and then the next step after that's good to go is that individual within a group. One thing I do want to point out is that, I'm sorry, go ahead, Ashley.
I just want to also put in there that this process does take a little bit of time, but once you've submitted and they do accept your group application, KMAP will send your application and any documentation that you've attached, and they automatically already send it over to any of the MCOs that you've selected in here. So that's really nice. Once they send it to them, the MCOs have 90 days for their credentialing and an additional 30 days to start that contracting. So
it's a long process. So get that started today. So I guess while you're waiting, so once you get that individual, or once you get your group pharmacy set up, I do encourage you to go ahead and have your pharmacist start down the application for CAQH, because pharmacists will need that CAQH profile accepted and that number ready to go to be ready to do your individual within a group. So if you do not have your CAQH profile set up as a pharmacist, please do that now. I will stop my share here in just a moment, and we'll drop a link into the chat of a KPHA website that if you're a member, you can help with that. Actually, I have it set up as a password, so anybody can access it right now. So I'll drop that into the chat for you for attending this webinar. But so again, a couple of steps at a time, get it started now. Eloisa asks what step it was, but when it asks for Medicaid programs, do I put yes and enter my Kansas information? And I'll let Ashley tackle that, but I think the answer is going to be no, but I'll let her too.
Yeah, so you said the Medicare programs, was that the question,
You
Amanda?
asked specifically about Medicaid programs.
Okay, yeah. So if you are already enrolled with any of the other Medicaids, it was earlier in, let's find what step. And then you just want to mark, it should be if you're in any other states.
Yeah, it was other states, because when Ashley went through it, they're really using that kind of as a factor to whether you would have to be charged a fee or not. So it was the other states.
I was going to say, I can't believe nobody's asked that question yet, but since they haven't, we'll ask Ashley, how much does this cost?
So it gets calculated if for some reason you do OFB, they recalculate it every year. So just know that this number does change and it can go up every single year. but the year currently for 2024 is 709, and it is per each location. But if you've already paid the fee, then there are ways that it can be waived. Again, it gets calculated when you do that application. If you've already paid that facility application, then you won't have a fee due today.
Remember, most of you won't because you already are filling Medicaid claims.
Yes.
Yep. So if you filled a Medicaid prescription in the last year, you should be good to go. No additional fees necessary. Make sure you get that process started. I don't see any other questions in the chat at the moment, which again surprises me a little bit. Do take the opportunity to ask questions if you have them. For right now, I do think that covers most of the questions from last time. One other question maybe I'll ask is, why would it be important to put your Medicare information into this?
That's again for that claims billing and just having that crossover claims that you want to click. So that way that it just kind of puts it all in place where it does that cascading effect for your billing of your claims. But also, again, if you've already paid for a Medicare fee, if you've done the application and you've paid the state is really not looking to double dip by any means. So that goes into that calculation process. If you've already gone through it and paid to enroll and be a part of that Medicare, then they're going to waive that fee for this.
Okay. Well, if nothing else at the moment, I did say, oops, let me put this in the chat real quick before I forget. Here's the link to our KPHA resources, the clinical services page that does walk you through how to do that CAQH application for pharmacists. Again, everybody in every pharmacist in the state should have that. And I would recommend starting that process now sooner rather than later. It'll walk you through the steps on how to get all the information you need ahead of time. So it only takes probably 20-30 minutes to go through that application, and should be good to go. The password for that site is POCT, or the abbreviation for point of care testing. So yeah, please don't hesitate to avail yourself of that resource. It'll be a members only page at some point. It's taken us a while to build our website out. So for right now, anybody can access it with that password. And we've got our emails here, as well as the KMAP phone number. That's Ashley helpfully put the phone tree in there, so you don't have to do all the waiting for that too. So please don't hesitate. If you have any questions or anything like that, please don't hesitate. I corrected her email just a little bit, but not quite enough. So Ashley did helpfully drop her actual email into the chat there. So please don't hesitate, if you have any questions, to reach out to the email that's in the chat, not the email on your screen. So I took that down for you. With no further questions being dropped in the chat, we'll go ahead and wrap up here today. Again, please do stay tuned for our individual within a group how-tos that should be coming through here probably in the next few weeks. And we will hopefully walk you through those exactly as well too. So in the meantime, if you have any questions, don't hesitate to reach out. And thank you for your interest in providing non-dispensing services to your patients. Have a nice afternoon.